We're also a church that practices generosity on a regular basis. We give away the entire cash collection for the first Sunday of each month to organizations that we feel are expressing our values in the world and in our community, and are also engaged with members of our church. And today I want to ask Judy Hembry to come forward from Health Volunteers Overseas. As you listen to her, you'll notice on the contribution card in your pew, there's a QR code if you're a smartphone user. There's also a way to put a check in there. If you put a check, just put HVO in the memo line. Welcome, Judy. Come talk to us. Let me get your thing here.
Good morning, and thank you for coming on this holiday weekend. More of you than I expected. I'm delighted to have this opportunity to speak with you about Health Volunteers Overseas. I have been going to Hospital Albert Schweitzer in Haiti since 2000, and for the last 7 years I have done so as a teaching volunteer for Health Volunteers Overseas. HVO's mission is to improve the availability and quality of health care through the education, training, and professional development of the health workforce in resource-scarce countries. HVO begins projects only at the invitation of the host institution, so a local partner is always guaranteed. HVO sends volunteers not to do the work. This does not improve access once the volunteers are gone. HVO seeks to teach all levels of healthcare professionals how to improve their skills. Volunteer physicians, dentists, nurses, physical, occupational, and speech therapists, and others all contribute. While HVO's impact is global, it's the power of one person's story that brings this impact to life. I'd like to share a story about Willin, a young man who grew up in the mountains of Haiti in a very poor area. He was selected for a 9-month HVO rehabilitation technician training program, largely on the basis of his gentle soul. I was privileged to share in the teaching provided by HVO volunteers. Willin did not know a word of English when he began the program. Many of the classes, including mine, were taught in English using an interpreter. While some of the students knew some English and thus heard the material twice, Willin understood it only once. He struggled, but worked hard, graduated, and went to work at Hospital Albert Schweitzer, and then rotating through 3 community clinics serving the very poorest people. Over the last few years, Willin has received additional training, learned basic English, and grown in confidence and skills. I witnessed this on my return to Haiti during a morning conference at the hospital. The doctors were discussing the tragedy of a mother and child who had been lost in childbirth the previous day. The mother had complications and had arrived at the hospital from far away in the mountains, too late for life-saving care. There was some mention that perhaps the family should have or could have brought her in earlier. From the back of the room, Willin spoke up. He reminded people that some families were so isolated that even a horse could not get up the trail to their home in the mountains. He said that families must carry an adult down the mountains, usually on a wooden door, a treacherous journey, and that coming to the hospital is an extremely difficult undertaking. Suddenly, the room was silent. The tone had changed. Everyone was reminded that there was another side to this story. There was no further mention of the late arrival. I was thrilled to see this growth in Willin's self-confidence and ability to speak for his people. This is the transformative power of education. I ask for your assistance today to help develop more frontline healthcare workers to serve in these faraway places. Thank you for supporting Health Volunteers Overseas through this first Sunday collection. I'm grateful for the generosity of this congregation.
Thank you, Judy. We have been greatly blessed. Let us give generously to bless the work of HVO and all the people affected by their volunteering and their effect on the world. The offering now be given and received.